Okay, good morning, all of you. Today we shall start on another topic in the blood, which is nothing but uh, about hemostasis. Now, what does hemostasis means? Now, hemostasis means that maintaining a constant environment. Homeostasis means maintaining a constant environment, and hemostasis means maintaining the constancy in the flow of the blood. Now, there are two structures which are playing a very important role in maintaining of this hemostasis. One is the platelets, and the other is the coagulation system. So, we have got two systems here where in homeostasis, on one hand, we have the condition where the blood is fluid in nature, and this fluidity of the blood has to be maintained. On the other hand, it is also essential for the maintenance of homeostasis and a part of hemostasis that whenever there is an injury to the body or a vessel wall is damaged, it becomes very essential that the blood flow from the damaged vessel should stop. That means the bleeding should stop. So body is trying to maintain a balance between two systems where on one hand when you don't have any injury and under normal conditions the blood should continue to flow in the vascular systems, that is in the arteries, capillaries and the veins in a fluid condition, but on the same side, whenever there is an injury or a damage to the blood vessel wall, the body should stimulate certain mechanisms to see that the bleeding gets arrested or the bleeding gets stopped. For this, the blood has to stop. For the bleeding to stop, a clot formation is essential. So on one hand, the fluidity has to be maintained. On the other hand, when there is a damage to the vessel wall, this has to be stopped, the bleeding has to be stopped, and this is done by a clotting mechanism. So let us see briefly about the two important structures which are playing a role in the maintenance of this hemostasis. So one is the platelets. We will briefly discuss today about the platelets and its structures and its functions which are happening today in the body. Okay. Now, we know that the blood consists of three cellular elements. One is the RBC, the second is the WBC, and the third and the most important, and not most important, equally important is the platelets. I will run through these slides, briefly letting you about the descriptive natures of the platelets and its functioning of the platelets and what is its role in hemostasis, that is in maintaining the fluidity of the blood and also at times when necessary stimulating the clotting mechanisms and taking part in the formation of a blood clot. At the end of this, we should briefly discuss about the pathological conditions or the pathophysiology associated with the clinical conditions when the platelets counts are increased or decreased. Now coming on to the platelets are also called as thrombocytes. Cytes means cells, thrombo means thrombus, means a clot. So the cells which take part in the formation of a clot or help in the formation of clot, hence it is also called as thrombocytes. So the other name for the platelets is the thrombocytes. The size of the platelets are, they are very minute structures. They are about 2 to 3 microns in diameter, and they are discoid in shape. And when you see a blood film tomorrow, when you come to the lab and you see a blood film, you will see that apart from the WBCs and RBCs, in addition to this, you will also find in the peripheral smear a small disc-like structures, and these disc-like structures are nothing but platelets, which are about 2 to 3 microns in diameter. The characteristic features of this platelets is that it does not contain nucleus. So nucleus is absent in platelets, and whenever there is no nucleus, that means there is no DNA and RNA, and in the absence of a DNA and RNA, the ability to multiply is lost. So these platelets are anucleated cells or do not have any nucleus, and they cannot multiply. Now the platelets have got structures which have got cell membrane and cytoplasm. So when you see the whole constituent of the platelet, you will find that there is a outer membrane which is normally like any other cell membrane. So that is called as the platelet membrane. Inside the cell membrane, you will find that there are certain cytoplasm. There is a cytoplasm, and in this cytoplasm, lot of secretory granules are present, and each of these secretory granules play an important role either in maintaining the fluidity of the blood, or whenever there is a need or necessity, they also help in the clot formation or the arrest of bleeding. So as common, the cell membrane contains of the platelets also contains of glycoproteins and contains of phospholipids. So what is the importance of these glycoproteins and the cell membrane here? The ability of this cell membrane, the characteristic feature of the cell membrane of the platelet is whenever there is a need, whenever there is a damage to the cell membrane, whenever there is a damage to the vessel wall, and the vessel wall can be the capillaries or it can be the arteries or it can be the veins. Whenever there is a slight trauma or whenever there is a hole or a rent in the blood vessel wall inside, you will find that the cell membrane of the platelets is the first structure to go and attach to the site of the injury. At the same time, it is so flexible that when there is no damage, the cell membrane does not stick on to the vascular endothelium. If you just briefly remember, the vessel wall is nothing but a vascular structure, whether it is an artery, vein or a capillary. The innermost structure of the vessel wall is a endothelium. So as long as the endothelium is intact, there is a continuity of the cell of the endothelium, or there is no interruptions or damage or breakaway of the endothelium. The platelet cell membrane or the platelets will not adhere or will not bind to the vessel wall. Only when there is a damage to the cell membrane, to the vessel wall, or there is an interruption or breakage in the continuity of the innermost layer of the capillary or the vessel wall, that is the endothelium, there the cell membranes or the cell membrane of the plasma platelets will go and bind. So that is the characteristic feature of this plasma cell membrane, that as long as the smoothness or the continuity of the vascular endothelium is maintained, it doesn't stick on to them. The moment there is a breakage in the continuity of the endothelium, this platelets will go and adhere at the site of injury. So this binding up of these platelets to the site of the injury is mediated through the cell membrane. and this cell membrane, like any other thing, will contain glycoproteins and phospholipids, each of which is very important, which we shall see in the subsequent slide. So what are the glycoproteins present here? The glycoproteins which are present here are these functioning as a receptor. If you see that glycoproteins means it is a carbohydrate and it is a protein. So a protein carbohydrate combination is present on the platelet cell membrane, and this glycoprotein acts as a receptor. So cell membrane receptors, if you remember the earlier class, the first class which we have taken in the cell membrane, we told you that one of the function of the cell membrane is that it can act as a receptor. Lot of cell contains on the cell membranes are protrusions which are known as glycocalyx, and these glycocalyx structures are functioning as receptors and help to bind other cellular structures or other cells. Similarly, the cell membrane of the plasma of the platelet contains a glycoprotein, and one of the glycoprotein acts as a receptor, and that receptor has been named as GP1B receptor. Similarly, there is another receptor which is present on the surface of the platelet cell membrane, and that is a GP2B and a 3A receptors. So the next question is, what is the function of these receptors? The GP1B receptors, that is the glycoprotein 1B receptor present on the cell membrane of the platelet, with help in platelet adhesion with the help of von Willebrand factor. Now what do you mean by von platelet adhesion? So one of the mechanisms in the formation of a platelet plug is platelet adhesion. So by platelet adhesion we mean that platelets coming and binding to each other. So the binding up of one platelet or the attachment of one platelet to the other platelet is done by means of this glycoprotein on the cell membrane, and that binding of one platelet to the other platelet is mediated by another process, another protein which is called as von Willebrand factor. And where is this von Willebrand factor? The von Willebrand factor is a plasma protein which is present in the plasma in the circulation. The other receptor is the 2B receptor and the 3A receptor. This 3B, 2B and 3A receptor, which is a glycoprotein on the cell membrane of the platelet, also helps in binding of the platelet, but here it helps in platelet aggregation, and that is done with the help of fibrinogen. So basically, if you see this, both the cell membrane contains of certain glycoproteins, that is the composition of the cell membrane of the platelet. It contains two receptors, GP1B receptors, 2B receptors and 3A receptors. 1B receptors helps in platelet adhesion. Platelet adhesion means that binding up of these platelets to the cell membrane, and in this process, this binding of this cellular structure, that is the platelet, to the blood vessel where it is flowing. So this binding is mediated by the 1B receptors, whereas the function of the 2B receptors and the 3A receptors are that once platelet aggregates to a particular vessel wall or binds to the damaged vascular endothelium, other platelets also will come and stick to that particular platelet. So it is something like a chain reaction where you will find that the cell membrane or the vascular endothelium is injured. Injured vascular endothelium, the cell platelets, one platelet comes and binds. This is mediated by 1B receptor. Once one platelet comes and binds to it, there will be other platelets also coming and binding either directly to the vascular endothelium or the vascular wall which is damaged, or will bind to this particular platelet which is already attached to the damaged endothelium or the damaged vessel. So this is mediated by 2B and 3A receptor. Phospholipids. Now the phospholipids also play an important role in the synthesis of certain substances. The two substances which are important here are the prostaglandin synthesis and the platelet procoagulant activity. Now, what is this prostaglandins? These prostaglandins are substances which are released from the platelets and formed by the phospholipids which is present in the cell membrane. So what does this prostaglandins do? In fact, these prostaglandins are synthesizing certain substances by which you will find that stimulation of these prostaglandins will cause these cells to get certain vasodilatation. So what do you mean by vasodilatation? Vasodilatation means increase in the size or the diameter of the cell. Normally, the presence of these prostaglandins will cause the vascular wall or the vessel wall to increase in diameter. When there is an increase in the diameter, that means that there is more space left for the platelets to squeeze through their way without getting congested or without getting aggregated. So the important role of the prostaglandins here is that it secretes a substance which helps as vasodilatation. The vasodilatation helps in increasing the space within the vessel wall to allow easy access or easy flow of the platelets within the plasma. Now you know that, imagine that there is a small tube, something like a straw size, that is a vessel capillary, and in this capillary the blood is flowing. So in this small straw-like structure capillary, which may be the thickness of a straw, there the WBCs are passing, the RBCs are passing through, the platelets have to pass through, and the plasma proteins are also present. Now what does this do? If the prostaglandins are secreted and it increases the size of the vessel wall, that means imagine your straw getting little increase in the diameter, that is vasodilatation. So a vasodilatation is increase in the diameter. If the diameter is increased, there will be more free accessibility for the platelets to pass through the vessel wall without coming close contact with each other, and thus preventing platelet aggregation and initiating a clotting factor, initiating a clotting mechanism. Also, it has a role in procoagulant activity. So, it promotes the procoagulation activity when it is stimulated. We'll come into the details later. Now, when you see the inside of the cell, when you see the inside structure of the cell cytoplasm, you will find that there is a canonicular system. Now, the word canonicular means there are lot of canals or channels which are present, canals or channels present, which are formed by the invagination of the cell membrane. Now, when this cell membrane communicates with the interior or cause an invagination, it communicates into the exterior, as a result of which the contents of the platelets can be secreted to the outside of the cell. So, it has got a canonicular system where a lot of canals or channels are present, and these channels help the platelet cytoplasmic contents to be put into the ECF from the inside of the cell. The other function is that they have got microtubules. Now, microtubules are the the basic structural unit of the cell, where it provides support to the platelets and prevents the collapse of the cell. These microtubules is nothing special in platelets. It is also present in most of the cells, so that the integrity of the cell, the shape of the cell is maintained. So also the microtubules which are present in the platelets helps in maintaining the discoid function of the platelets. The other is the microfilaments. The microfilaments which are present have contractile function. Now, there are three structures which are present in the microfilaments. One is the actin, the other is the myosin, and the other is the thrombostinin. We will discuss this in the subsequent things. Now, what is the role of actin, myosin, and thrombostinin? To give you a brief idea at this point of time, the actin, myosin, and thrombostinin are the contractile proteins or the contractile substances which are present in the platelets. Now, what has actin, myosin, and thrombostinin to do inside the platelets. That is the most important function is done by the actin and the myosin. Now, when the platelets are forming a platelet plug, that means they are aggregating together, the one platelet has to hold on to the other platelet. This binding of one platelet to the other platelet is done by the actin and the myosin filaments. And the thrombostinin. Thrombostinin is another contractile protein which is present in the plasma, and once that is activated, it causes the contraction of the platelet structure so that the whole clot gets contracted, and when these actin myosin filaments along with thrombostinin clot, they pull the vessel wall towards each other, and when they pull the vessel wall towards each other, the opening up of the clot is closed. To give you the example or explain here, as I said, there is a straw. Imagine that straw which through both the ends the blood is flowing within the system, and in the middle of the straw there is a small hole or a small damage has been done. So there is a rent which we call as an opening. Now there is a possibility that the blood which is flowing through inside the claw or inside the straw will ooze out from the vascular system into the surrounding tissues. So at this point of time, the platelets will come and bind into the damaged endothelium or the capillaries. One platelet will come and attach, more and more platelets will come and attach. So they will temporarily block the thing. But now to bring the two ends of the vessel wall close to each other so that that opening or that rent or the hole in the vessel wall gets sealed, it has to contract. So for that contraction, it is the actin, myosin and the thrombostinin proteins or the thrombostinin substances which help in the contraction of the plug, that is the platelet plug, so that the ends of the damaged vessel wall are brought together. So suppose if this is the vessel wall which we are seeing, instead of opening or a rent, it is cut here. So if the vessel wall is cut here, what is happening? The platelets come and aggregate here. Once a platelet comes and aggregate, you will find that it is temporarily blocking the opening, so the bleeding will get arrested. But now to bring these two ends close together, something has to pull the platelet plug, and so that the two ends are pulled together. This is done by the actin, myosin and the thrombostinin. Next, let us come on to the granules of the cytoplasm. The granules of the cytoplasm, that is the granules present in the cytoplasm, are of two types. One is the dense granules and the other is the enzymes. Now, what does the dense granules contain? The dense granules contain the ADP, ATP, calcium and serotonin. The alpha granules will contain the clotting factors, the von Willebrand factor, the platelet-derived growth factor, thrombospondin and fibronectin. Now remember, each of these substances which is present here has got an important role either in the arrest of bleeding or in the formation of a clot. The ADP and the ATP will provide the necessary phosphates and the energy for the platelets to cause the contraction of the actin and the myosin filaments which are present. In addition to this, the calcium which is present has got two functions. One, the calcium is necessary for the contraction of the actin myosin filaments present there. In addition to this, the calcium is responsible or necessary for the clotting factors to get activated. So once there is a damage to the vessel wall, the initial platelets will play a role in trying to arrest the bleeding, and once the first phase, that is the arrest of bleeding, is finished, then the next step will be the formation of a clot, and in the process of the formation of a clot, calcium plays an important role. So what role it will play there? It will activate the clotting factors so that the clotting factors become activated and help in the clot formation. The next, serotonin. What is the role of the serotonin? Whenever the serotonin is secreted, remember that it is a vasoconstriction and it causes the constriction of the vascular smooth muscle so that the arrest of bleeding takes place. Now the alpha granules will contain the von Willebrand factor, it will contain platelet derived growth factor, thrombospondin and fibronectin. So what is the role of von Willebrand factor? Von Willebrand factor is a factor there where once it is secreted by a platelet, it will make the platelets more sticky, or adhesiveness or stickiness of the platelets will be increased so that one platelet binds to the other platelet very easily. In fact, stickiness of the platelet is increased because of this von Willebrand factor. So whenever the platelets gets activated, it means that the activation is because of this VW factor. Next, the platelet derived growth factor. The platelet derived growth factor, the word itself shows the growth factors derived from platelets are called as platelet derived growth factors. And what does this do? It helps in promoting the growth of the damaged vessel wall. If you would have seen, when you get injured, there is a bleeding for some time, and after few days, 1 or 2 days, you will find that bleeding area gets healed. That means what? The capillary which was destroyed there, which were damaged there, now becomes healed. So what is the healing process taking place? So the damaged vessel wall is being repaired by the growth factor stimulating the fibroblast invading that particular area and multiplying in number so that more and more fibroblast comes together and they form a dense fibrous tissue in the damaged vessel wall. So that healing process requires certain fibroblasts to be stimulated, and that is done by the platelet derived growth factor. Thrombospondin is a substance which helps in sticking of the one platelet to other platelets. Von Willebrand factor will increase the stickiness of the platelets. That is, a normal platelet will not adhere to each other as long as it is in a normal circulatory system. Normally, as the blood is flowing, you don't find one platelet or the sticking to the other platelet. In fact, they repel against each other. But only at the damaged side, the platelets need to get attached to one another and to the damaged area. At that such point, the stickiness of the platelets is increased because of the von Willebrand factor. Once the stickiness is increased, the binding of the platelets because of the stickiness to one another is done by thrombospondin. Fibronectin, as the word suggests, nectin is helping in growth factor. Fibronectin is a substance which helps in repair of the damaged tissue through the fibroblasts. Next, we have got certain enzymes, and what is the role of the enzymes here? The adenosine triphosphatase and the enzymes necessary for the synthesis of prostaglandins. So, the cytoplasm of the platelets will contain certain substances which are necessary for the synthesis of the ATP and also ultimately formation of the prostaglandins. Now, in addition to this, you will also find that the cytoplasm of the platelets will contain certain factors, like important among them is the fibrin stabilizing factor. Now, fibrin stabilizing factor is also an important substance which is secreted from the platelets, and when the cytoplasm of these platelets release the fibrin stabilizing factor, you will find that the fibrin which is formed, or the fibrin threads are formed, which are very weak, will get converted into a strong covalent bonds, and that formation of a monovalent bond into a covalent bond is helped by means of the fibrin stabilizing factor. Next, coming on to the functions of the platelets. The first function of the platelet is that it plays a role in hemostasis. In simple word, hemostasis means prevention of bleeding from an injured blood vessel. So the first structure to come into picture or help in maintaining the hemostasis or preventing the bleeding from the injured side is the platelets. So the platelets help in the arrest of bleeding from an injured blood vessel. The second is vasoconstriction. Vasoconstriction is the narrowing of the arterioles due to the action of serotonin secreted by the platelets. So the second function of the platelets is it causes vasoconstriction of the damaged vessel wall by secreting serotonin. If you remember a few minutes ago, I told you that the platelets contain certain cytoplasm of the platelet helps in secreting of certain substances, and one of the substances is serotonin. Now adhesion. Let us go on to the technicalities of technical things here. What happens at the side of the injured vessel wall? So one of the step which is taking part in the arrest of bleeding is adhesion. Adhesion means binding up of the platelets to the subendothelial collagen with the help of von Willebrand factor. Now there is a vessel wall. As long as the vessel wall is uninterrupted, the endothelium is smooth, the endothelium is uninterrupted, the platelets are flowing in the circulation. They are flowing in the circulation along with the WBCs, RBCs in the plasma. Now once this platelet comes in contact with the damaged area, or suppose you have injured yourself with nail or a sharp object, you will find commonly you will see that if you just leave it as such also, you will find that initially 1, 2, 3 drops of blood may flow and afterwards it will stop bleeding. How is that? What is the mechanism which is happening where without you doing anything, the bleeding comes to an end? Or if you would have seen that if you have gone to give some blood test to a hematology, to a laboratory, they will prick you with the needle, they will draw some blood. After some time, they will just put a cotton and ask you to put pressure. Within few minutes, you will find that there is no more bleeding and that injured side gets repaired in 1 or 2 days. So how is that hole which was made by the entry of the needle or the hole which was made by injury by a nail or a thorn or a sharp object prevents the bleeding from that particular area? This is the where in such instances where the continuity of the endothelium is broken down or there is a damage, the platelets will come and bind to it. That binding of platelets to the endothelial collagen is called as adhesion. So why it is subendothelial collagen? When you see the histology of the blood vessel or the capillary, you will find that there is a epithelial layer from outside to inside. There is a muscularis mucosa which is present, and the innermost layer is the endothelial cells. The endothelial cells are resting on a basement membrane. Just between the outer surface and the basement membrane, there is a collagen present. Hence, it is called as subendothelial collagen. So, once there is an injury, the platelets will come and bind to this subendothelial collagen with the help of von Willebrand factor, and that is called as adhesion. So, normally these platelets are circulating as disc-like structure. Now, when there is an activation, what is happening is once such a platelet or once some platelet comes in contact with the damaged vessel wall, they bind to that particular damaged area. And how do they bind? They bind by sending out certain pseudopodia, and this pseudopodia will help in attachment of these platelets to the damaged vascular wall. So now which was disc-like structure will become spherical in shape with the help of pseudopodia, and at the same time you will find that the reorganization of microtubules will take place. The actin and the myosin filaments will move out and bind to the collagen which is present there. Now once that binding is happened, then there is a secretion. Now what do they secrete? The ADP which are released from the dense granules promote platelet aggregation. So once one platelet comes and binds, it binds there, it becomes activated. Once it becomes activated, the cytoplasm will release certain substances, and one of the substances which is released is ADP. So what does this ADP does? Once the ADP is released into the platelets, the stickiness of the platelets is increased. So the ADP increases the stickiness of the platelets, and once the stickiness of one platelet is increased, the other platelets which are passing through there will come and bind to this one platelet. As a result of which now you will have two platelets at the site of injury. Now this second platelet already binding has taken place, aggregation will start, that is adherence has happened, activation has happened. Now the second platelet binds to the first platelet, it gets activated and it also starts releasing ADP. So that increases the stickiness of the second platelet. So now it activates the another platelet which is passing by from that particular area, and the third platelet gets activated. So in this way you will find that one platelet initially will now you will see within a few seconds hundreds of platelets coming and binding to that damaged vessel wall. So this is because the activated platelets gets secreted ADP, increases the stickiness, binding up of more and more platelets takes place, and a platelet aggregation takes place. They also synthesize the thromboxane A2. Now what is thromboxane A2? Thromboxane A2 is a substance which causes the adhesion of the platelets. So it is a platelet aggregator. So these platelets will also synthesize from that prostaglandins through the cyclooxygenase pathway. It will break down into the thromboxane A2. So the prostaglandins which are synthesized getting broken down into thromboxane A2 is by means of an enzyme cyclooxygenase. So this cyclooxygenase will now cause aggregation of platelets. Clinically, I will tell you the importance of this cyclooxygenase and thromboxane A2 here. Now, what does this mean? The aggregation of platelets normally in an injured area is happening because of the increased secretion of platelets and synthesis of thromboxane A2. So thromboxane A2 is a substance which when synthesized causes the platelets to get aggregated, right? Now suppose there is a tendency in a person where the endothelium is little damaged, like in a person who is having a high cholesterol level where the cholesterol level is binding to the vascular wall. The chances are in such obese persons, the cholesterol gets deposited onto the vascular endothelium and stimulate the platelets and causes the platelet aggregation. Similarly, in persons where age-related atherosclerosis takes place, when you go back after the class, read what is atherosclerosis. Briefly, I will give you only a few seconds, I will explain. Atherosclerosis means where there is more of damage to the endothelium because of aging or because of stress, because of diabetes or because of uncontrolled blood pressure. The high pressure with which the blood is flowing in these capillaries and in these vessel walls and arteries, or because of the high blood sugar, there is a sclerosis taking place, that is the collagen tissue becoming more sclerotic. So such a sclerotic vessel wall, there the platelet binding chances are increased. So we have got a situation where either because of obesity or because of diabetes or because of hypertension, there is certain changes which are taking place in the vessel wall, and it is called as atherosclerotic vessel. Or in a person who has already undergone a surgery where they have taken rest for a long period of time, sluggish circulation is there, or somebody had a heart attack and a coronary artery disease. And to give you the latest example here in this pandemic, where patients who are recovering from the COVID-19 will show certain clotting tendencies. So what is clotting tendency? In all these situations which I have mentioned, there is a tendency of the blood to clot. The tendency of the blood to clot means what? The first step is platelets getting aggregated, and once the platelets gets aggregated, they initiate or the formation of a platelet plug, and this will stimulate the clotting mechanism, and that platelet plug will result in the formation of a clot. So you understand here the basic pathophysiology. Till now I have talked about the physiology. I am talking about now what happens if the physiological functioning gets deranged or gets damaged or gets diseased. So either of these conditions, we find that there is an increased tendency to clot formation. So as here, one of the tendency of the formation, one of the reason or the cause for the formation of a clot here is the synthesis of your thromboxane A2 through the cyclooxygenase pathway. To prevent this, a drug called ecosprin or acetyl salicylic acid, ASA. Go back again little later and see the ASA or the ecosprin or clopidogrel. These drugs are given to prevent the clot formation. So what does these drugs do? Once you take that aspirin or ecosprin or ASA or clopidogrel or combination of ecosprin and clopidogrel 75 mmHg, you are blocking the synthesis of thromboxane A2. How does this drug block the synthesis of the thromboxane A2? By inhibiting the cyclooxygenase pathway. So once the cyclooxygenase pathway is blocked, the synthesis of thromboxane A2 is reduced, so the platelet aggregation is reduced. That is the clinical significance here, where when you want to prevent a clot formation, you give ASA, ecosprin or aspirin and prevent this step of aggregation, so that the risk of clot formation is reduced. But when there is a need for the formation of a clot, the body responds by causing increased thromboxane A2 synthesis, resulting in the clot formation and the arrest of bleeding. Now, this is which I have explained to you. The phospholipases act on the membrane to form arachidonic acid. Arachidonic acid is converted into prostaglandin G2 and H2 by cycloogenase. They are then converted to thromboxane A2 by thromboxane synthesis. I hope this slide is clear. Now the next step here is after activation, aggregation. That means platelets binding to each other with the help of a substance which is called as thrombospondin, and little later when the clot formation takes place, they help the fibrinogen which is present in the blood, also helps in aggregation of the platelets. Now how does this aggregation takes place? ADP released from the platelets will cause the inhibition of the adenyl cyclase and reduce the cyclic AMP in the platelets. So this ADP, as I said initially, stickiness of the increased and they bind to one another. How does this happen? It decreases the level, it inactivates adenyl cyclase, the cyclic AMP reduction takes place, a configurational changes takes place, so that now this receptor, the glycoprotein receptor, I told you the 2B and the 3A receptors which is present on the cell membrane of the platelets now become exposed to fibrogen. So once that receptor is exposed, what happens is that the fibrinogen will come and bind to the platelets. Once fibrinogen binds more and more platelets, it helps in increasing the platelet aggregation. Not exactly causes the platelet aggregation, but it helps in increase platelet aggregation. Now once the activated platelets release, now we have got activated platelets. The activated platelets will release both ADP and thromboxane A2, and both of them will cause more and more platelet aggregation, leading to the formation of a platelet plug. So in this way, one of the second important function of the platelet is the formation of a platelet plug. I have just gone through the steps how a platelet plug formation takes place. In addition to this, the thrombin which is generated from the coagulation system converts fibrinogen to fibrin. This is a minor function. So first there are platelet aggregation taking place. All the platelets are forming a platelet plug. Once the platelet plug is formed, the cytoplasm will release certain substances which will cause the formation of the thrombin, and this thrombin also helps in conversion of fibrinogen to fibrin. Though this is not the main function, it is only a helper function which is doing in the formation of fibrin. So what is a platelet plug? Platelet plug is a temporary hemostatic plug. Now this temporary plug has to be converted into a solid mass of cells so that it does not get dislodged, and that temporary hemostatic plug getting converted into a solid hemostatic plug is nothing but the clot formation. So indirectly platelets help in formation of clot. But remember one thing, the platelets are responsible for only the arrest of bleeding. Temporary cessation of bleeding is done by platelets. They do not directly take part in clot formation. They help in activation of the substances to initiate the clot formation. But the arrest of bleeding is the primary function of the platelets, and it is done by the formation of a platelet plug. Now this is the third function which we are dealing, that is the platelet procoagulant activity. That means the platelet helps in clotting mechanism, in coagulating mechanism. So another function of it is platelet promoting coagulation of the blood. Now how does this do? How does it do? So when the platelets are activated, the negatively charged substances become exposed on the outer surface. We'll go a little later here. Now once these charges are exposed, they stimulating the clotting factors. This we will deal in the later factor. And what is the clotting factor? Converting factor 10 to factor 8, conversion of prothrombin to thrombin. At this point of time, you just remember that the platelets have got a little procoagulant activity. This procoagulant activity is because of the substances released from the platelets, which stimulates certain conversion of activation of thrombin, and this thrombin acts in conversion of factor 10 to activated factor 10A and prothrombin to thrombin. In other words, to cut it short here right now, platelets help a role in activation of many of the clotting factors. It also helps in secretion of calcium, where calcium also plays an important role in the clotting mechanism. So you should remember here that the clotting factors are normally inactive. When they come in contact with the platelets activate the clotting mechanisms by activating those different factors. In addition to this, the calcium which is secreted from the cytoplasm of the platelets also play an important role in the activation of the clotting factors and in the formation of fibrin thread. Next, the other and the most important role of the platelet is clot retraction. Now imagine what has happened. A damage has occurred, platelets have come to the site of the injury, a platelet plug is formed. Now all this platelet plug after some time gets converted into a clot. In some time, after a few minutes, you will find that a whole clot is formed. Now once the clot is formed, after the complete mechanism has been done, the contractile proteins which are present in the platelets, that is the actin, myosin and thrombostinin, contract, and when they contract, they reduce the size of the clot and they bring the damaged vessel wall ends to near to each other, and a temporary plug is now something like a solid mass. So this is an important function, and the clot retraction time is around 30 minutes. So normally you will find that once the injury has occurred and the clot has formed, the clot retraction takes place 30 minutes. If there is a delay, if there is an increase in the clot retraction in the time, what do you imply? That means if the clot retraction time instead of 30 minutes is increased to 40-45 minutes, it means what? It means that the number of platelets are less, hence there is not adequate actin, myosin, thrombostinin to cause the clot retraction. So a prolonged clot retraction time of more than 30 minutes indicates that there may be less platelets in the body. Also, lastly, the platelets play an important role in the repair of the injured blood vessel. Till now, we have seen a damage has taken place, bleeding is occurring, blood is flowing out of the damaged vessel wall. The platelets and the clotting factors help to stop that bleeding. Hemostasis is arranged. But the next step is the damaged vessel wall has to get repaired, and that repair is done by fibroblast. The cytoplasm of the fibroblast contains certain platelet derived growth factors, and these platelet derived growth factors help in repair of the injured blood vessels. In 5 days to 7 days time, you will find that at the side of the damaged vessel wall, you will find that the platelet derived growth factor stimulating the fibroblast multiplying and increasing and forming a fibrous tissue, so that the hole or the rent is permanently closed and is a solid repair where furthermore injuries cannot lead to bleeding again. So this is the thing. How does it causes? It causes the growth of the vascular endothelial cells. That means what is damaged? The vessel wall is damaged. And how it can be repaired? By causing the growth of the endothelial cells, which is the innermost layer. It is causing the repair of the vascular smooth muscle cells, that is which is present between the basement membrane and the endothelial cells, and the fibroblasts. So all these cells get multiplied and the damaged vessel wall is converted into a fibrous tissue. The platelets also play a role in the defense mechanism, where it helps in phagocytizing certain immune complexes and removing certain antigen antibody complexes. If you remember in the last week class, I had told you antigen antibody reactions. Once the antigen antibody forms, it has to be removed, and platelets play a little role in that removal of the immune complexes. They also play a role in the damage or killing up of the viruses. In addition to this, as the platelets pass, they also have a tendency to uptake the serotonin. Serotonin is a storage function, so the platelets store serotonin, and whenever there is a release of these substances, whenever there is a need or whenever the platelets are activated, the cytoplasm will release the stored serotonin, so that it causes vasoconstriction. Now, let us see briefly after these functions what is the normal count of the platelet. The normal count of the platelet is somewhere around 1.5 to 4.5 lakhs per cubic mm. So at any given point of time, the platelet count should be 1.5 to 4.5 lakhs per cubic mm. What are the physiological variations? That means where do you find little changes in these platelet counts? One, with age, the platelet count is less in infants. It is also less during the menstrual cycle, and it is slightly increased in high altitude, or it is increased after severe exercise, and after meals it is increased. So these are the physiological variations. What do we mean by physiological variations? Physiological variations means the count should normally be 1.5 to 4.5 lakhs. When is it increased and when is it decreased? In normal condition. So it is increased whenever there is a high altitude, you go to a high altitude, or it may be increased after severe exercise or after food. It is decreased during the cycles and when in children. Now, what do you call an increase in the platelet count? An increase in the platelet count is called as thrombocytosis. When do you see that there is an increase in the platelet count pathologically? Physiologically, we have seen it is increased after exercise, meals at high altitude. Pathologically, it is thrombocytosis can be seen after splenectomy. Why do you see an increase in the platelet count after splenectomy? It is because the spleen is the site. If you remember in the last week, I had told you in the reticuloendothelial system that it is the system where the liver and the spleen and a part of the bone marrow help in removal of the damaged area. If the splenectomy is done, if the spleen itself is removed for some reason, the platelet counts will appear to be high. Then hemorrhage. Whenever there is an hemorrhage, the platelets are released, so there is an increase in the platelet count. After delivery also, you will find that there is a little bit of thrombocytosis. What is a decrease in the platelet count called? A decrease in the platelet count is called as thrombocytopenia. Now, what is the cause of the thrombocytopenia? There are, one is idiopathic thrombocytopenia. What do you mean by idiopathic thrombocytopenia, where there is no cause for the fall in the platelet? The second could be a bone marrow depression. There, bone marrow depression means the bone marrow is not producing the platelets, and the cause of this could be either in cancer patient when you give certain cytotoxic drugs. Cytotoxic drugs are those drugs which destroy the which destroy the cancer cells. When the person is on cytotoxic drugs, little bit of damage to the bone marrow may occur, bone marrow depression may occur, or there may be a whole body irradiation where for some reason to treat cancers where you cannot give cytotoxic drugs or chemotherapy, radiation is given. When such radiation is given, it can cause a bone marrow depression, or when you get exposed professionally to certain radiation hazards, so you will find that thrombocytopenia is there. In acute leukemia, there is a decrease in thrombocyte and in the platelet count. Leukemia, why should there be a decrease? Because all the cells in the blood, leukemia is a blood cancer where most of the cells, that is the pluripotent stem cells which are responsible for causing the platelet formation, are now have directed and are producing only WBCs. If you remember, I told you the pathological cause for increase in the WBC count is called as leukemia. So where you will find that in leukemia more number of WBCs are present along with immature cells. In such a condition, the platelet count may be less. Splenomegaly, as I have just told you, that damage to the spleen or removal of the spleen may also cause a fall in the thrombocytopenia. Initially, because there is no damage, removal of the cells taking place, it may cause increase. But here also, over a longer period of time, you will find that there is thrombocytopenia, but that is doubtful. The other is septicemia, infections causing a fall in the platelet count. Now, one of the reason I would like to mention here of thrombocytopenia is, if you remember the year 2018 and 2019, what has not been mentioned there is viruses. One of the cause of thrombocytopenia and an important cause is viral infections. So if you have seen in 2018 and 2019, probably you would have been at the time in your 9th or 10th class, dengue fever. Many people were suffering with this dengue fever, where you would have seen that the patients would have had suddenly in high grade of fever, chills and joint pains. In addition to this, a couple of days later, you would have seen that those patients coming with certain bleeding tendency, bleeding from the gums, bleeding from the nose, or they might have come with certain blue patches. So what was that in 2018 and 19, especially if you remember and go back to your past memory, in the month of summer, at the end of the summer, onset of the rainy season till the winter season, many number of patients, it was like an epidemic where everybody had fever, chills and rigors, and when the platelet count was done, the platelet count was less. So most of them had thrombocytopenia. So what was the cause of the dengue fever? It was a virus which was injected into the body by a mosquito. So the mosquito bite, normally the mosquitoes increase or multiply in rainy seasons. So an increase in those mosquitoes, in the mosquito load causes increased mosquito bite. Many people were bitten by mosquitoes, and this mosquito then transmits a virus into the body, and this virus multiplies in the body and starts damaging the platelets. It starts attacking only the platelets. So this platelet gets damaged. As long as the virus is inside the body, the platelet count starts dropping. So instead of 1.5 lakhs to 4.5 lakhs per cubic mm, the platelet count would fall to 1 lakh 50,000, critical level 20,000. At that particular time, the most complication things which would arise is bleeding. There can be bleeding from anywhere. Bleeding from the GI tract, bleeding into the brain, bleeding from the nose, bleeding from the gums, urethral bleeding. So the bleeding tendency would occur. So remember here, in those conditions, They found that there was a thrombocytopenia, the count was decreasing. The critical count below which the bleeding can occur spontaneously was 50,000, 20,000 to 50,000 cells per cubic mm. If the count falls below 20,000 per cubic mm, there is an increased bleeding tendency. So here you do a bleeding time on a patient, and when you check the bleeding time, instead of normal bleeding time is 2 to 4 minutes, it gets prolonged. So thrombocytopenia was the complicating thing. The persons were dying not because of the virus causing anything, but because of the low platelet count. So remember one thing, viral fever causes thrombocytopenia, and that is transmitted by mosquitoes. So there the platelet counts gets reduced. Initially, how do you manage such a case? You give certain vitamins, chemicals, and if you remember, certain papaya was also advocated. Take that seeds or leaves, it increases the platelet count by increasing the production of platelets from the bone marrow. Or in extreme cases, steroids were given, which will help in preventing the virus destroying the platelets. Over a week's time, the platelets gradually improve. So this is about the pathophysiological and the early clinical exposure. Example or a class on early clinical exposure where a decrease in the platelet count, thrombocytopenia was seen in dengue fever, which is caused by a virus, and that virus enters into the body through the bite of a mosquito. Then how do you identify this? When the platelet count is low, I mean extremely low, it is somewhere if it falls below 20,000, the clot retraction is deficient, there is a poor constriction of the ruptured blood vessels. This results in a clinical syndrome called as purpura. So what is purpura? Suddenly on the skin you will find in the subcutaneous tissue that is under the skin, bluish patches will appear, small about 1 to 2 centimeters in diameter, bluish patches appearing, which is called as ecchymosis. Or you just injure or you hit that particular area, there you will find that within a few minutes a bluish discoloration happening, and that was because of thrombocytopenia, and that condition where, and that's patch which rounded in shape, bluish ecchymosis is called as purpura. Now, where does the formation of platelets takes place? The platelets are formed by thrombocytopoiesis. It is the bone marrow which stimulates this formation of the platelets. It is the pluripotent stem cells. From the pluripotent stem cells, you will find that it is the megakaryoblast. The megakaryoblast will form the promegakaryocyte. The promegakaryocyte will get converted into megakaryocyte, and ultimately platelets are formed. So the site of production of the platelets is the bone marrow. The bone marrow produces the platelets from the pluripotent stem cells. As I said earlier, the pluripotent stem cell word itself will get potent stem. They are pluripotent, that means they can produce any type of cell. The pluripotent stem cell gets converted into a megakaryoblast. The megakaryoblast gets converted into promegakaryocyte. The promegakaryocyte gets converted into megakaryocyte, and the megakaryocyte gets converted into a platelet. Now, a unique feature of thrombocytopoiesis. So, the production of these platelets is called as thrombocytopoiesis. So, what is this thrombocytopoiesis? The thrombocytopoiesis is nothing but it is endomitosis. That is a nuclear division within the cytoplasmic maturation, but without cell division. So, here it is example of endomitosis where the cell doesn't divide, but the nucleus divides. Hence, you will find that there are dense cytoplasmic granules, and this dense cytoplasmic granules will have lot of chemicals stored in it, plus they also have the pseudopodia which extend around it. The lifespan of a platelets, if you see the platelets, the formation of a platelets, it takes about 10 days. So from the time of stimulation of these platelets till the release from the bone marrow, that is the whole process from the pluripotent stem cells to the megakaryocyte buds pinching out, it takes place about 10 days. The lifespan of the platelets once it is released into the circulation is 10 to 12 days. So if there is a thrombocytopenia patient coming and you give him certain stimulants to increase the production of platelets, it will take about 7 to 10 days, and the life of the platelet once released into the circulation is somewhere around 10 days, is around 12 days. What factors will control thrombocytosis? The thrombopoietin and the megakaryocyte stimulating colony factor will control the thrombopoiesis. So thrombopoietin is a substance which is released in the body. This thrombopoietin and a megakaryocyte colony stimulating factor. So it is not CSA, it is CSF. So MGCSF, that is a megakaryocyte colony stimulating factor, and thrombopoietin will control the formation of the platelets in the bone marrow. Same also here. Once the platelets are released into the circulation, 1/3 of the total platelets are in the spleen. The remaining of them are in the peripheral blood. The same way, the platelets are also destroyed by the reticuloendothelial system, that is the tissue macrophage system in the spleen. So out of the total platelets which are being produced in the body, 1/3 of it are stored in the spleen, 2/3 remain in circulation. Ultimately, after the lifespan of 10 to 12 days, the old platelets are destroyed in the spleen by the tissue macrophage system. Thank you once again, and the other part of it is the clotting factor. We will continue on Friday morning. The anatomy department has completed their portions, so they will not be taking any more classes till the 1st June. And tomorrow the physiology class has been cancelled. The biochemistry people will continue their class. We will meet again for physiology on Friday at 10 a.m. Thanks one and all.